I'm going to share with you today two experiences that I had, one with an Italian psychologist and one with an international coach. And the first one with the psychologist, it was during 2023 in one of the worst periods that I had in my life. Basically, I was heavily stressed. I had a lot of issues in my home. I have a lot of workload from my university. I have a lot of workload from my sport. I had a lot of trouble because I repeatedly failed in many areas of my life. Basically, I received a kick in the nuts after another, and I was heavily stressed. All in my difficult family situation was just making it worse. I was so burned out that I dissociated from my body and was unable to feel any sort of joy and happiness in that period of time. I basically, what happened to me was depersonalization. And for you that never experienced depersonalization, is basically when you perceive your consciousness out of your body. You feel like you're sitting down in your head. It's very hard to explain to someone that never experienced it, but basically it's like playing a video game when you are the main character. No, it's not as cool as it sounds. In fact, it's very horrible. And every pleasure that I had before, I was unable to perceive. I was unable to perceive it. Food didn't taste good. Training didn't felt good. Getting out with friends wasn't that enjoyable. And it was so bad that for a time I thought about killing myself. I thought about literally unaliving myself, and that thought was very scary to me. So I decided to talk to a professional about it, since it was a very it's not a nice thing to unalive yourself. So I asked for university. There is a free counseling service that is offered to its students, and so I was hopeful to find someone that could explain me what the hell was going on and give me some guidance. After that I've done the first encounter, I basically yapped to him for 10 minutes about all the shit that was going on in my life, and I was very clear. I can speak in a pretty articulate manner. Also, I wrote down I do a lot of journaling, so I wrote down all the issues that I had, and once I explained everything to my counselor, his response was, "Oh, you explained everything to me with very great precision. So, what's your question actually?" And I was like, "Man, I just told you that I want to kill myself, and you don't have any answers or solutions or ways that I can prevent it for doing shit like that." And that left me a little bit puzzled. Then I came back a second time, and I talked more about the trouble that I have in my home. And he insisted to talk about the relationship with my dad. My problem was that I had some goals, I had some things that I wanted to do, and he was focusing in a nearly with perverted curiosity, I would say, with my relationship with my dad. I was like, man, I don't give a shit about how I relate to my dad. I want you to solve me this problem so that I can go on in my life. And when I asked him if there was any way that which reframe my situation, manage my mind workload, manage my stress, in order to be more efficient, his answer was, "Oh man, just do less stuff." And I believe that, honestly, this is one of the problems with therapy for men, because the fact is, I personally, and most men that I know, most friends that I have, are external problem solvers. And therapy doesn't account for that. Men try to solve internal problems with external solutions. And this is not a misogynistic or a generalization. This is something that is known in literature, in psychology literature, and the differences between the two sexes. And men are more oriented towards practical solutions in order to fix their internal problems, while women are more oriented towards internal solutions. So they vent about the problem, they talk about it in a very articulate way. And the fact is that psychotherapy has a strong bias towards women. Around 62% of all patients are women, and 70% of all psychotherapists are women. So psychotherapy is something mostly done by women for women. So talk therapy is the main thing. And I'm not saying that talk therapy isn't useful. I'm saying that it's not the only intervention, it's not the only thing that can work with men. And by the way, I'm talking about my experience, so an episode of, let's say, depression. I wouldn't even call that depression, because depression have other characteristics. All right, I'm talking about symptoms of depression, symptoms of anxiety, which are common in the general population. I'm not talking about schizophrenia. I'm not talking about very debilitating disorders that can limit your daily life activities. Okay, I'm talking about things that normal human beings who function pretty well can experience. So I had another experience with mental health providers, which was with an online service of coaching, which was Healthy Gamer, one association online that offers coaching to people that ask for it. And my experience was very much more positive with this one guy, my coach that I'm working with, because of one specific reason. First of all, he was actually interested into what my goals were. Maybe my psychologist was just a bad psychologist, okay? I want to point out that. But not only he was interested in my goals, he has had a very big orientation towards practical things that I can do in my day-to-day life in order not only to reframe my mind, but things that I can actually do in order to reduce my symptoms of anxiety, depression, and direction and meaning in life. Okay, so I'm not saying that talk therapy is useless for men. I'm saying there are other modalities can be used for helps men mental health, and I'm going to explain two ways that are believed not more effective, but could be more effective for men and their mental health. The first one is work with more goal orientation. So the fact is, you as men, you want to find more practical solution and changes in behavior in order to solve things that are not working. Have you ever witnessed the situation where a girl is just yapping and saying things about a problem, and a man is like, oh, have you tried this? Have you tried doing this? Have you tried doing this? And the girl says, I don't care about you telling me solutions. I already know solutions. I just want to express my emotions. And the man is like, oh, why the fuck does she need to do that? Just do, if she has the solution, why the hell is she talking? The problem is that because men are usually more oriented towards practical changes in behavior. So I believe that things like life crafting interventions, where the therapist and the patient talks about future vision, setting smart goals, crafting an action plan, and get accountability, might be more effective than classic talk therapy for men. And I sincerely believe that another thing that could help are more somatic biased intervention. What do I mean by all of these buzzwords? Just move your body, because psychotherapy, this is a problem. Psychotherapy in general, and mental health in general, which is we often see the mind and the body as two separate things, while something that is not explained enough is the relationship between physical activity and mental health, between the physical body, between being in an open space, between action and relationship with mental health. Specifically, what I'm talking about physical activity, there is this beautiful study where a group of 7 men practiced psychotherapy with MMA training. I'm not joking about it. You can see the article in the description. And the whole program was associated with an improved quality of life, relationship, fitness, and self-efficacy. The reason for it is because not only physical activity itself is very useful for mental health, but also because they will find a group of other people that were like-minded and they can share a common activity. Community is something that do more for mental health than psychotherapy itself. And also it was proved that heavy physical exertion is associated with improved outcomes for depression and anxiety. And some studies also, I believe, showed that running was as efficient as SSRI for treating depression. I'm not, it's, yeah, I believe it was SSRIs. I'm not sure about the precise pharmaceutical intervention, but it was as effective as SSRI, at least. As effective or more effective, I don't remember it exactly, but it was very useful for treating depression symptoms. And I believe that practicing physical activity, creating communities are things that can be more helpful for men these days and their mental health. I hope that this video was useful. Remember to aim upward as always.